can see how quickly the post loosens. The vibration transfers through the metal and helps disrupt cement deeper in the canal where you cannot simply reach initially with a burr or an ultrasonic tip. Once the post is out, I move on to gutta percha removal. I use alpha with 4004 plugger at 230 degrees for no more than 5 seconds to soften the gutta percha. Then I begin removal with a 2006 rotary file, gently advancing without forcing it. If I feel resistance, I stop immediately to avoid file ledging or separation. Instead, I reapply heat with the alpha to soften the material further, and then I try again. If my rotary file still isn't making any progress, I switch to hand file using combination of watch winding and balance force with a drop of chloroform. I don't like using a lot of chloroform unless it's a thermophil case because chloroform melts gutta percha, which is great, but possibly you can push the infected dentin and defective gutta percha material outside of the canal, which can cause extra radicular infection, which would lower the success of your retreatment. In this case, because the original canal was fairly large, I enlarged the coronal third with 3504 to improve straight line access. Next is finding your working length. What I do is intentionally advance to the red zone first to confirm apical patency, and I pull back to the 0 mark. That's at least how I personally establish my working length, and I use this approach consistently in retreatment or any root canal cases. If my apex locator is not being so nice, then I use file shot to confirm the length. I then move into ultrasonic irrigation. Activated irrigation creates acoustic streaming that helps irrigants reach lateral canals and areas we cannot simply mechanically instrument. Remember, instrument shape, but the irrigant's clean. Thorough irrigation is critical for successful chemomechanical debridement, especially in retreatment cases with resistant bacteria. For shaping, I personally prefer austenitic non-heat treated files. They are efficient, predictable, and gives me consistent length control. For obturation, I downpack to approximately 13 mm using alpha at 230 degrees, then continue condensing down with size 40 nitite condenser, and then I backfill using size 23 gauge beta mini needle, which provides ideal backfill pressure for a dense 3D obturation.